Some knee replacements are unavoidable and you have to do them, but we need to figure out why we're having the knee replacement in the first place. So we're going to talk about in this video on exactly what we need to do before the knee replacement and then after the knee replacement to make sure that it's successful. Let's get into it. If you're having a knee replacement, you might have bad genetics, your parents might have had it, you might have siblings that also struggle with their knees. There's a lot of people that have knee problems, but just knowing what's going on with your knee and how we load it and how that puts stress on the knee is really important because that's what's going to dictate what happens after we have the knee replacement. So we're replacing the joint. So really thinking about what's happening as we get a knee replacement, they're cutting out this joint right here. So they're going to cut out this bone, they're going to cut out this bone, and they're going to replace these two segments right here. And so now this is a consequential joint. It's just going forward and backward. It has a little bit of rotation, that's it, but very little. It's going forward and backward. So it's at the consequences of all the range of motion at the ankle and all the range of motion at the hip. And so what we want to be thinking about is what's happening in those areas because we're having the knee replacement. They're going to cut those pieces of bone out and they're going to replace it with a prosthetic. And so it's an easy joint for them to replace and it should be an easy rehab, but we see all too often that people struggle with the rehab. They get irritated and they don't get the outcomes that they're really looking for. And so in this video, we're going to talk about the reasons why that is and what you can do to prepare yourself. What forced you to have a knee replacement is that we keep loading the knee over and over. So when I'm bending over, so I'm gonna just pull my pant leg up so you can see it. So if I bend over and over through my knees, I'm just beating up on my knees. These muscles up here, the quad, is doing all the work. It's putting pressure on my knee. I'm coming up and down like this. I'm not gonna do this too many times because it can cause me a problem. So what we wanna do is go through our hips. We want to have an even distribution between our hip and our knee, but that's not what happens over time. Over time, our hips get tight. We don't use them as much. We sit on our butt because that's the positions that life put us in. We are driving all the time. We're working all the time. We're eating. We're always in a seated position. So our hips get tight and we load through our knees consistently. And so that causes stress to come down on the knee, put pressure on the joint all the time because we're constantly putting pressure on the muscles around it. And so think about it like this pant leg. If I have a tightness in this pant leg, it's got a lot of stress on the bottom of the pant leg. It's the same thing as on my knee. Those muscles are always being used and they're putting pressure on the knee, and it's because of our movement patterns. And so if we want to take stress off of the knee, we have to change the movement patterns and change how the relationship of the muscles, how they're gliding around the knee. And we have to redistribute that stress up the chain and have a little bit of mobility in the ankle as well. And we're going to talk about that in this video. We're going to put together videos on exactly how we address the hip, the knee, and the ankle because all of those joints work together when we're walking, when we're running, when we're doing activities, when we're being active outside, all of those joints are working together. And so we have to address each one of them, and it's not enough to suffice just for one video. We need to break them up. So follow us for exactly what we do in the clinic, and we can show you how to make your knee replacement to be as successful as possible. When you're going to get a knee replacement, we are replacing this joint. We're putting too much emphasis. Everybody puts too much emphasis on the quad and they want to strengthen up the quad. Well, the quad is an overused muscle. What happens when we see people their knee replacement, pre-surgery, is that their quads are really tight, their hamstrings are really tight, their calves are really tight. They have that corkscrew, they got twisted up. It's always tight right there and they're not using their glutes enough. And we have to think about the knee. The knee is going forward and it goes a little bit to the side. We have this wiggle in it. Our glutes are going to be able to control us from going too far forward because we can shift back and use those muscles. And then also it can pull us out to the side. It pulls this femur muscle, the femur bone out to the side and controls whether we put a bunch of stress on the inside of the knee. The majority of the clients that we see, they have a lot of stress irritation on the inside of the knee and the front of the knee. And that's what they're complaining about when they come in. So we want to loosen up those muscles. And loose muscles, like they have pliability in them, those are strong muscles. We need that. We can't just be always in a contraction. If we're using a certain muscle all the time, it's going to be constantly contracted. It's not really strong. So we've got to strengthen those muscles. So we want to loosen them up, get blood flow to them, and strengthen them up as well. And we have to redistribute that load up the chain into the glutes. We have to get significantly more firing in our glutes to redistribute that load and take it out of these smaller muscles. It looks like the quad is a huge muscle right here. It's long, but the biggest muscle group in the body is the glutes. And so we really have to respect that and change our movement patterns where we start sitting back into our hips and using these muscles prior to going into a knee replacement so that we can preserve the new joint that's being put in. After your knee replacement, you have a new joint. And so what doesn't change is that we have muscle pulls that are happening around the knee. So we've got to loosen those up. The best ways to loosen up those muscles is actually to roll them out, loosen them up, roll them out, and then load them in a range that's not causing you any pain. We should be doing that with our calf, with our hamstring, with our quad, and with our glutes. And we should be firing up those glutes consistently. If you're doing that, then you're going to have less strain on the knee over the long term, and you're going to set yourself up for success with a knee replacement, because we are changing what the soft tissue structures, what the muscle structures are doing around the knee. Just replacing the joint isn't enough because a lot of that irritation is happening with those muscles around that joint. Remember that we need extension at the hip. We need to be able to get full extension in the hip. The glute needs to be firing. We need to be able to get full extension at the knee. That's the number one thing that you need to be doing in rehab after you have a knee replacement. You have to get to 0 degrees. You have to be able to straighten your knee out as quickly as possible. You want to be able to get to straight, because when you're walking and I'm stepping through a pattern like this, I should be able to step through and get my knee completely straight. That takes stress off of the knee. And then also at the ankle, we should be able to bend this ankle 10 degrees of dorsiflexion. So making sure that we're loosening up the calf by breaking up the tissue, rolling it out, but then doing a stretch where we stretch our gastroc muscle, the bigger one, and then our soleus, and we're loosening that up with calf stretches consistently. So we're firing up the glutes, we're loosening up the calf, and we're doing that consistently. Consistency with a knee replacement is the most important thing. When we see people in the clinic, if they're not consistently doing their exercises those first 6 weeks out of the knee replacement and not causing pain, when we have problems with the knee replacement, what we see is that people are having pain because they're trying to push it into flexion too much. Don't chase flexion. Flexion will come back as your inflammation goes down. What we really need is extension, and we need to do our exercises consistently where they're not causing pain. We'll go through videos exactly what we do in the clinic and how we help our clients. So follow us for videos on exactly how we do that. Get mobile and stay active.